Good evening, everyone. Welcome. It's another episode of Fertility Talk. And this month we are we're still talking about miscarriages. It's quite a big subject. I keep saying that because it's one of those things that are, if you've gone through it or you are going through it or you've been through it, it's extremely devastating and it takes and can take quite a bit to get through it. But it's always the thing about the question of why it happened and, blaming yourself and so forth. So tonight we have Dr. Yoks, and she is a fertility specialist at KZN, Vitalab KZN. So welcome, doctor. Thank you for joining us this evening. And please take a few minutes to just introduce yourself, what it is that you do, and so forth.
Okay. Thank you so much, Leanne. It's always nice chatting with you. Uh, Good evening, everyone. I am Nolu Yolositu, but my name is too long. My surname is clicking, and so Yoks is my nickname, and then my surname is Sigu. I work at in Durban at KZN Vitalab Fertility Clinic.
Thank you very much, Doctor. So we have a few questions for you. And like I mentioned, we are still talking on the subject of miscarriages. And tonight's one topic is causes of miscarriages. So the first question is, what are the primary causes of miscarriage and how do they vary between early and late pregnancy losses?
So, just coincidentally, last month we were talking, or the emphasis was on making sure that the pre-pregnancy health is good. So let me start off by saying that when you're planning to fall pregnant, make sure that you are healthy in all aspects. When it comes to the causes of miscarriages, what normally happens is a third of the miscarriages, or even more, we don't know why it happens, especially with the first trimester miscarriages and it's happening for the first time. We always try and look for cause and we can't find the cause. But what we know is, especially if it happens within the first trimester, we always say it could be chromosomal. That means the chromosomes were abnormal, the chromosomes that the baby had could not keep on with life. So that's why it happens. So we're talking about things like trisomies, trisomy 12, trisomy 13, which is much more common. And then sometimes what happens is the abnormalities within the uterine cavity. So if it happens for the first time, you can say it could be that it's not going to happen again. But if it happens again, then we need to look deeper and see why it's happening. So if the uterus itself has got some abnormalities, it can lead to a miscarriages. Or if some people, you might know that you've got fibroids, because if you've got fibroids, then fibroids can lead to miscarriages. Bear in mind, it's not all fibroids. It just depends where they are located. If they are pushing onto the cavity, that is where the baby is lying, yes, they might cause miscarriages. But the ones that are usually found far from the cavity do not lead to miscarriages. Then the other thing that you might find with miscarriages is if you have diabetes, then diabetes can also lead to miscarriages happening quite early. And some people, it's actually when they get miscarriages and they are investigated for that, then they would find that, oh, it's actually this. Then one of the rare things that happens is the clotting profile. So what happens is if you have a clotting disease, we call it the disease that affects the placenta. The placenta is what links the baby to the uterus. So if you have a clotting disease, then the blood supply to the placenta doesn't get there well. So what we call it antiphospholipid syndrome. So we would look for that and see if you have one of those, and then you will have to be put on medication or blood thinners when you fall pregnant. Some people get put on that even before they fall pregnant, you know? So it's just one of those. And then infections, we often think that miscarriages cannot be caused by an infection. But if at the time of an infection, it's discovered that, I mean, at the time of a miscarriage, it's discovered that you have an infection. And sometimes when we look into the placenta and analyze things further in the lab, then they would also pick up the infection that you have, which is one of the reasons why pregnant women need to have their urine tested more frequently. Because with the urine, you can get a urinary tract infection that doesn't show as it normally does in pregnancy. Just
Okay.
a few of the causes.
Yeah, thank you. I always used to wonder why they always checking pregnant women's urine. Like, she's already pregnant. Why? You know, that it might sound strange, but now I'm actually realizing why it happens. Thank you for that. Can genetic factors such as chromosomal abnormalities play a significant role in causing miscarriages?
Yes, of course, chromosomal abnormalities do play a significant role in causing miscarriages. You know, some chromosomal abnormalities, a baby can be born with them, like, you know, your Turner syndrome, you know, people that have got Down syndrome, but some of them, it depends which chromosomes are affected and at how significant they are affected. So chromosomal disease, it's one of the common things, which is why when you are pregnant, we do take the products, that is the miscarriage products, and then we send them to the lab so that they can be analyzed and we get to know if there are chromosomal abnormalities. And then if, for example, there is a genetic problem that it's known in the families, then they can also be tested, and then, you know, probes can be made so that for future babies, when you have babies, then you can actually do what we call pre-implantation genetic testing, whereby we will look and see what's happening.
Okay, perfect. Thank you, doctor. Um, our next question is, how do maternal health conditions such as diabetes, which you just touched on, or autoimmune disorders contribute to the risk of miscarriage?
Okay, so we will start off with diabetes, which is much more common than the
Yes.
autoimmune disease, depending on where you're looking at it. So when it comes to diabetes, in general, when a woman is pregnant, you get there is the pregnancy hormones, you know, your insulin, the insulin that is in our body in general. But now when you do fall pregnant, the pregnancy hormones might confuse your insulin metabolism, right? And then you find that insulin doesn't act the way it's supposed to act. And then, you know, that leads to glucose not being metabolized normally. And
Yes.
then, which is another reason why when you have diabetes, when you have a history of diabetes, we would not normally ask to test you quite early unless you have symptoms. So what happens is, because of the pregnancy hormones earlier on, they confuse the thing, all right? They confuse the body. And then they might act as if you are diabetic, whereas you're not, which is why some people would feel hungry more often than not during pregnancy,
Yes, yes.
especially in the early stages of the pregnancy. So diabetes, it does escalate, and it might actually be a problematic. So which is why we emphasize on screening you before you fall pregnant if you have risk, and making sure that things that could actually lead to you being diabetic, you are taking care of them. That means your lifestyle in general needs to be a healthy lifestyle around pregnancy. All right. So now when it comes to autoimmune disease, sometimes you get autoimmune disease leading to underfunctioning thyroid, for example. So if the thyroid is underfunctioning, what then happens is it does affect the baby. It does cause the baby not to grow well. And you might find that you get excited, I'm pregnant, and then all of a sudden the baby stops growing. And I mean, it happens quite early in life, you know, and as well as the other autoimmune diseases that people might get, you know.
Okay, perfect. Thank you. Our next question is, are there any lifestyle factors such as smoking, alcohol consumption, or exposure to environmental toxins that increase the likelihood of experiencing a miscarriage?
Okay, so I mean, smoking. it does affect our health in general. It affects how we breathe. It affects how our blood transport oxygen, which we need so that we can breathe. So if your blood has got less oxygen, then there's going to be less oxygen going to the baby. So it causes a ripple effect. Then some alcohol. Sometimes when you drink, you don't eat healthy. So that's one of the issues where it is. Plus, with alcohol, it tends to affect the baby. You know, what is called fetal alcohol syndrome. I think it used to happen a lot in the early 80s, and then people became aware, and then, you know, but it does happen a lot that when you drink and you are pregnant, you can actually affect your baby. You affect your baby's brain, and the baby could be born, but sometimes the way the brain is functioning, it's not okay. The way the baby is growing, it's not okay. And one thing I forgot to mention about the diabetes is sometimes with people, when you go and book and you are diabetic, we never actually know if you book late. I'm just talking about those people that fall pregnant spontaneously. When they go late to the clinic, and when we do measurements, your tummy might be bigger than what the baby actually is, because if you are diabetic, then your baby can actually be diabetic as well whilst in utero. What do I mean by that? It tends to be bigger than normal, and then you tend to have excess fluid around the baby as well. That can also lead to other problems like preterm deliveries, or what could actually happen is if you have preterm deliveries, the lungs with diabetic babies are not fully developed. And then what also happens is when your lifestyle is not completely ideal, you know, because I mean, from time to time we all default, but when you are pregnant, you need to try and keep it healthy.
Okay, perfect. Thank you, doctor. Our last question is, what role do hormonal imbalances, including progesterone deficiency or thyroid disorders, play in the occurrence of miscarriages?
Okay, so with thyroid deficiency, I just mentioned briefly when I was talking about autoimmune diseases, because with thyroid deficiency, then what then happens is the baby stops growing because the baby needs sufficient thyroid hormones from the mom as well so that they can grow well. All right. Then, so what would happen? I'm sorry, I missed the other question.
It's hormonal imbalances, including progesterone deficiency.
Yes. So progesterone, I mean, we like talking about the corpus luteum. So progesterone is the hormone that is actually, it's pro-gestational, so it's pro-pregnancy. It nourishes the pregnancy. It makes sure that the baby grows well. However, for those people that have low progesterone, it's been said that, oh, we call it luteal phase deficiency. That means that there is not enough progesterone. So then when we supplement with progesterone, then pregnancies goes well. However, then we tend to only get to know about that in a woman later that, oh, this was progesterone maybe deficiency. But now what we do early on in pregnancy, we do measure progesterone levels. However, we just need to know that this is an ideal level. So if we see that the levels of progesterone are low, we often say that you need your progesterone to be at least more than 50. So if you've got progesterone that are less than 50 in pregnancy, then we need to supplement, especially in early pregnancy.
Yeah, I've actually just got something else that I want to throw in there. We spoke about hormonal imbalances. Where does PCOS comes into that with miscarriages? Because I know women with PCOS quite a lot suffer from miscarriages.
Yes. So women with PCOS, they suffer a lot with miscarriages because one, they also tend to have progesterone imbalances as well.
Okay.
Or what happens is they actually struggle to fall pregnant because they are not ovulating. All right.
Okay.
They will have too much estrogen in the body, but it's not actually causing the ovary to release that egg.
Yes, yes,
Okay.
yes.
So that's one of the problems. Plus, when it comes to PCOS, one of the things that happens is they tend to be obese. So they tend to have higher BMIs than normal.
Yes. So obviously the weight plays a big role when it comes to miscarriages as well. Okay.
Yes, it does. It does.
Okay.
It does.
Thank you very
Okay.
much. Thank you
All
very
right,
much
Leah.
for this, Doctor. It was very informative. I really appreciate you taking the time to do this talk with us. We've got another one next week, and next week's one was Dr. Kutsia, also from Vitalab, and we're talking about IVF and miscarriages. So please do join us for that, guys. Yeah, Doctor, if anyone wants to get hold of you at Vitalab, how can they get hold of you?
Okay, so our telephone number is 031 880 1700. However, people can also email just for information at KZN reception at Vitalab KZN and then
Yeah,
.com. And
from.
then or they can just email Yoks, which is YOKSS
Yes.
at vitalabkzn.com. Then
Perfect.
we will be able to assist.
Perfect. Thank you very much
And
for
then
this
we
evening.
or else they can even go onto the website, and then we are on Twitter, we are on Facebook, then they can get more information and look at our website as well.
Perfect. Yes. They are also on Instagram, and they will be tagged in on this video as well. So thank you very much for this, Doctor, and have a great evening.
Okay. Thank you. Thank you so much, Leanne. Great evening
Thanks.
to you too.
Okay,
Thank you.
bye.